You're listening to the Retirement Solution Podcast with John Hicks.
Helping you solve the retirement puzzle. Welcome to the Retirement Solution with John Hicks.
John, are you a New Year's resolution kind of guy?
Historically, I have been, and historically, I've sucked at keeping those resolutions. So last year, my resolution was going to be to get, svelte, to climb a mountain, and that didn't go so well. When everything went through shutdown, kind of didn't do that. As a matter of fact, I started climbing a mountain of bourbon bottles that I had emptied along the way. So, no, I do actually have a resolution this year, and that is to do what I should have done last year.
Oh, okay.
So, so I've already started the process
Nice.
of detoxing. Detoxing not only my body, but my mind. With all of the political ridiculousness and all of the polarizing, terrible stuff going on out there, guys. And I know you've been in the exact same situation I'm in. I've decided I'm just going to turn it all off for the beginning of this year and work on me and my family. And I think that that's probably the way that we're all going to get through most of this stuff, just by internalizing, working on being the best person we can be, whether it be with our family or our friends or our work or with our partner or even with our finances, frankly. Are we doing the best that we can do? Have we hired the best team that we can have with us? If we haven't, that's one good starting point. We can always try to figure out, okay, what can I do today to make life a little bit better for everyone around me too?
Absolutely. I think you're right about that. Kind of clearing your mind, giving yourself a little mental health check. That's always a good idea, especially with everything going on in the world today. And believe it or not, a lot of us, we all go through the health thing, right? Oh, we're going to go to the gym. We're going to eat better. We're going to do this and that. Well, with that in mind, any guesses as to how much of your nest egg will go for healthcare cost?
Ooh. Let's see. I always assume that everyone always gets completely fit in the very beginning of the year, because all those people that start off in January, they quit going by March. I assume they've already lost their 60 pounds and they have 12-pack abs and stuff.
Yeah, you're right.
Is that not the case?
Yeah, not so much here. So there's a projection from HealthView Services. They say a healthy couple retiring this year in 2021, they can expect to spend more than $660,000 on medical bills over the course of their retirement. And listen, that's in addition to all the other bills that you have going on there. So how the heck do we manage all this?
Well, $660,000 over the course of retirement, that's tremendous. I remember a few years ago, I'd seen another study, a similar study, that mentioned that a couple, if they retired at roughly 65, they lived a normal life period, it was only going to be about $350,000. So look how much over the last, 5 or 6 years, these projections have gone up. And probably because of this COVID stuff, right? Oh, yeah. All the cost of medical expenses and things like that. But think about that for 1 second, Jessica. Think about $660,000. Now, this is out-of-pocket money, right? This is after Medicare has paid their portion. This is after all that kind of stuff. That is a tremendous amount of money. But if you think about it, a lot of people, and even myself, I thought that number was outlandish. I thought, how could they come up with that? But what we started thinking about, what are your Medicare premiums each month? For a couple, multiply that by 12. And all of a sudden you start thinking, what are your co-pays? What do your prescriptions cost? It's a very reasonable number, unfortunately. So what can we do to manage that? Well, this is one of those big issues. This is essentially a piece of longevity risk, right? The easiest way to reduce our long-term healthcare costs is to die young. But most people
who wants to do that?
Most people aren't into that. It's like, listen, John, I understand about the resolution thing, but I do not resolve this year to kick off in my 40s. I don't think that is a great plan for me, to be perfectly honest with you. And I would agree. So the thing of it is, how do we pay for that? Well, you have to have some money earmarked. Now, if you've heard this show before, I don't really love long-term care insurance. I'm not against it completely. There are a lot of people it can work out for, especially if they want to sleep at night. But we have to have a portion of our savings that we know is meant and built to grow specifically for those long-term needs, right? And if it's not a portion of your portfolio, this is one of those opportunities where I've actually seen that some other strategies out there may work. There are some things called reverse mortgages. Now, we don't do that in our office. And historically, those things have been really terrible for the consumers.
Yeah.
But they've actually gotten better to the point to where you may have to consider that, because I'm talking to the people who maybe you haven't saved $1 million. Maybe you don't have $2 million. Maybe, it's really tough to make it on what you got, but what you got is what you got. And when you see these numbers, a lot of people, they want to give up. Don't do that. There's all kinds of strategies, but you have to be aware of the different ones available, because there are all kinds of things. You can earmark dollars. You can get long-term care insurance. There are some type of accounts that actually have riders on them that can provide you living benefits to pay for long-term care or at-home assistance in the event that a spouse or you require that. It doesn't necessarily cost nearly the same amount of money that it does if you were to buy long-term care insurance. And there are also ways, including reverse mortgages or other things, that can be done to accomplish this goal. But the one thing that I want everyone to please know, and please note, these numbers are real and they're not going away. So even if it feels uncomfortable that you may not be able to make it, this is where you want to get that plan. This is where you want to get that. I know it's a 4-letter word, PLAN, but you got to get that plan together on how it's going to work for you, because these costs aren't going down. As a matter of fact, with the new administration and the new costs associated with a lot of the social medicine that they're really proposing, there's no way in my mind that healthcare costs aren't going to continue to go higher and higher and higher. So make sure you guys got a plan. This is 2021, first week of this year. Let's start it off right, whether it's a plan for this or a plan for other finances. We know we got to pay for stuff as time goes on, so let's make sure we get that together.
Have questions for John? Drop us an email at retirementsolutionradio.com.
Financial professionals are not licensed in all 50 states. To find out if John Hicks is licensed in your state, please call 502-690-5635. J. Hagan Capital Inc. is not affiliated with nor endorsed by the Social Security Administration or any other government agency and does not provide legal advice. Annuity guarantees rely solely on the financial strength and claims paying ability of the issuing insurance company. By contacting us, you may be provided with information about insurance and annuity products offered through John Hicks, Kentucky Insurance License number 998827.